My name is Nellie, and I am in the 11th grade, and I have a story to tell. When I was born, I was diagnosed with a condition called hydrocephalus, which is not very common in many people, but it can happen. And so I'd like to explain a little bit about what it is and what treatments are available currently. So, what is hydrocephalus? Hydrocephalus is a condition in which fluid accumulates in the brain, typically in young children, enlarging the head and sometimes causing brain damage. So, fewer than 200,000 causes per year are found in the United States. It is treatable by a medical professional. It requires a medical diagnosis. Lab tests or imaging are always necessary in this case. And the extra fluid puts pressure on the brain and can cause brain damage. It's most common in infants and older adults. Hydrocephalus is characterized by an enlargement in infants. Adults and older children experience headache, impaired vision, cognitive difficulties, the loss of coordination, and incontinence. So, treatment is often a tube, a shunt, inserted surgically into a ventricle to drain excess fluid. So, hydrocephalus often requires people to have multiple visits to the hospital and frequent visits to a neurosurgeon and a neurologist. And this is because there are many components that are involved in hydrocephalus, and if something were to happen to someone with the condition and they weren't rushed to the hospital, they could face death.